You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Thanks for tuning in to another episode of the Expert Guide to Parenthood podcast. We're your hosts, Christy Hopwood and Freya Owen. And today we're going to be talking about a topic which is growing in popularity. We're going to be talking about the MACS, which is the Maternally Assisted Caesarean.
Now, to talk about this topic, we have our obstetrician expert, Dr Peter Jurcevic, back in the podcast chair. Dr Peter has more than 30 years of obstetrics expertise, and he is one of the Australian pioneers of the Maternally Assisted Caesarean. Welcome back, Peter.
Thank you for having me.
Now, what is a maternally assisted caesarean?
Well, I first want to begin by saying this is a topic that I'm extremely passionate about. And a maternally assisted caesarean section is a caesarean section like any other, but with the difference because what we are doing is allowing you to be involved in bringing the baby out onto your chest straight away so that you get that immediate bonding with your baby. And then from there on, we can go about the completion of the caesarean section as we normally would.
So Peter, what is the main difference then between a traditional caesarean and a maternally assisted caesarean?
Sure. Look, I've been doing these for over 7 years now. And the reason that I brought it into a commonplace part of my practice and why I'd like to see it be universally adopted is because with a traditional caesarean section, we will often have a screen up around the level of your chest so that you will be lying on the bed and you'll usually have had a spinal anaesthetic or an epidural, so you'll be awake. And often your partner will be at the top end with you next to your shoulder, but you are not able to see anything in the operative field. And then the surgeon, and let's say it's me and my colleague who is assisting the scrub nurse, will be on the other side of that screen and we'll be delivering the baby through the incision. And then when the baby is delivered, often what will happen is we'll be lifting the baby up over the screen, or we might temporarily drop the screen down so you can see the baby. And then we'll clamp the cord, and then what will happen usually is the baby will be handed to the midwife or to the paediatrician, and then at some point the baby will be brought to you. It may be first wrapped up and brought to you, or brought to you straight away thereafter. But really, essentially, there is a disconnect from that immediate time when your baby is born. Now, having delivered many, many babies for many, many years, and it's 30 years now, traditionally at a vaginal delivery, the baby will be placed straight up onto your abdomen or to your chest, and the cord is left attached. And there are some advantages to doing so. And so for me, I just saw this enormous disconnect from caesarean section. And when the opportunity came to start to do the maternal assisted caesarean sections, here I was being able to see a woman who spent traditionally 9 months carrying this baby day in, day out, night and day, having the first touch and the first hold of her baby straight onto her chest for that immediate bonding. And then we're able to do delayed cord clamping so that the cord can pulsate for at least a minute or so longer, and it allows that baby to establish its blood pressure and respiration, gives the baby a little bit of oxygen at the time, a bit of extra iron and blood, and then we can comfortably clamp the cord and go about the remainder of our surgery while you're still enjoying the baby. And that is the fundamental difference and really the fundamental advantage.
Now, Pete, what about disadvantages? Are there any risks of a maternal assisted caesarean that aren't present in a caesarean?
Sure. I'll answer this question by saying there are no additional risks. It is sterile, it is done safely, it is still done under the caring eyes and the expert eyes of the surgeon. So in the event that there are any unexplains that might occur at the time, which can be inherent in any caesarean section, we would react just as quickly. So there is no increased risk in infection, there is no increased risk in bleeding, there's no increased risk in any injury to the bladder or getting a clot in your leg, which are the inherent risks of a caesarean section and are quoted as very low risk at the best of times. So as a really simple short answer, there are no increased risks, there are only benefits.
Then why is it, Pete, that it's not common practice in every single hospital around Australia and the world to do this instead of a caesarean?
Look, I can't speak for choices between why different practitioners or different hospitals don't choose to do it. When I began doing them, it was a traditional caesarean section, so a baby that is head first cephalic, so it comes out head, shoulders, arms, and the mother would reach down and grab and bring it onto her chest. And then it became apparent to me, well, why can't we do this for all sorts of caesarean sections, not just an elective caesarean section head first? And so I've done many, many breaches where the baby's coming out legs first and the mother's holding onto the legs and we're delivering the baby's head and then flipping the baby onto her body straight away. For twins, I've done twins where you'll bring out the first baby and with the mother's help, and then she's holding onto it and then supporting that baby. She'll reach down and grab the second one. Wow. I've done that, and it's incredible to watch. For placenta previas, where they're low acuity placenta previas, where the risk of excessive bleeding at that particular moment is not deemed to be great, so the lower grade ones, we've been able to do that as well, and so the woman's able to still be awake, still have that pleasure of the first bonding moment without some of the frightening sort of thoughts that can occur with bleeding that can occur sometimes in these situations. For a emergency caesarean section where you might have obstructed and the baby won't fit, or there's deemed to be a baby that is not coping with the demands of labour and the acuity of the Caesar is such that we have that extra 30 seconds or minute of time to set up so that you can have a maternally assisted caesarean section, we've been able to do that as well. And again, you know, if you've been in labour for 16 hours and pregnant for 9 months and then we whiz the baby away from you, that's a shame. And so to get the baby straight away, but also importantly in that situation, the baby to have that extra minute or so on the cord so it can get its blood pressure back up, get its tone and colour, get that little bit of extra oxygenated support, extra blood auto transfusion. It's really, really important. So I've even had situations where we do what's called a PAC, a parentally assisted, where for a partner who doesn't feel squeamish and is happy to kind of stare at the operative field, we've been able to have them scrubbed and gowned and able to, with my support, assist in the delivery as the baby's coming out. And what an incredible experience for those couples where both the woman and the partner are simultaneously being able to have their baby. It is an enormous pleasure to do, and as a result of that, if I can do it in all those indications, I'd like to think that anyone else could, and hopefully it will become a more mainstream option for women.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
Are there any factors, Pete, which make someone a good candidate for a maternal assisted caesarean, or is it anyone?
I think that everyone who needs a caesarean section, and the only exceptions for not being able to do it would be, and I alluded to before, placenta previa, and you have a very complex high-grade placenta previa where there's likely to be really, really significant bleeding at that moment of incision, and that needs to be addressed immediately. That probably wouldn't be a good option, including particularly, of course, if you were to have a general anaesthetic, and most women don't have general anaesthetics for their caesarean sections, but of course if you're asleep you wouldn't be able to do it. And also to be simply just motivated. And I do have a few percent of women who are anxious, squeamish, and just think there's just no way I can
see
do
the
that.
blood.
And I respect that that's how they feel. But what I have noticed in all of those situations is that if you simply say to that woman, trust me, just let's get you set up to do it. The moment the baby's coming out, if you still feel that way and don't wish to be involved, we'll just do our traditional caesarean section, or we can sort of place it nearby you and we'll clamp the cord a bit quicker. But maternal instinct is extraordinary, and I've just never seen a woman who has hesitated when she's seen the baby come up. The women they just go for it. They just can't help themselves. And that's really nice to see that you've been able to comfortably place them out of their comfort zone, but in actual fact they weren't out of their comfort zone. They just didn't think it was and the reward that they get and the pleasure you get out of seeing it's awesome.
And so, Pete, how does it work, I guess, hygienically, having an open wound and a baby coming up? Is that traditionally why it's not placed up onto the chest?
So I know that there are increasing numbers of practitioners around the country that are starting to do this, and they would all have their own individual policies and protocols. For me, where I have had an infection-free run, no one's had an adverse infection from this. that's all due to the way we go about with our sterility preparation. So a traditional caesarean section, you'll have your abdomen prepped with some sort of disinfectant, and there'll be a drape placed over you, and then you deliver the baby through the operative field. Since you're going to be introducing your hands as the woman into the operative field, then your hands need to be the same as my hands. So I have washed my hands, I've gowned and gloved, so you'll do the same. So when you're lying there and we're prepping for the surgery, we'll quickly prep your hands and we'll just place a gown and glove over you. And yes, at that point in time when you bring the baby out, that first second the baby will be going onto your gown, but it literally only takes you a couple of seconds to take your gloves off and then whip your gown down, at which point that's of no concern to me because the baby's here and I'm still working down here, well away from where the baby is and any infection risk is. And the cord, of course, is clamped and we just go about things. So at all times it's very sterile, and we've been very blessed. I've been very blessed not to have had any infectious complications. How other practitioners would choose to do it and manage their infection risk, I guess, is up to them.
And I think, this is a good opportunity to look at Dr. Peter's socials because he's got great videos of mums and dads doing this.
Yeah, I was very, very lucky to have a really lovely patient of mine who I have delivered her family, and she very, very kindly consented to having a video taken of the experience as an educational opportunity for women who are thinking about going down this pathway and want to get a visual of what the process looks like from coming into theatre, having the actual delivery itself. And it really just step by step, very concisely, videographically says, this is what's going to happen. And I think women really appreciate that when they're making the decision.
Definitely. It's always good to know what's coming, doesn't it, rather than being in the dark. Yeah.
Absolutely. Knowledge is power. Well, thank you so much, Pete, for the huge gift that you give women in enabling them to have a maternally assisted caesarean, and for coming on the Expert Guide to Parenthood podcast again today.
My pleasure.
A huge thanks to Mistela for sponsoring this episode. Did you know that Mistela is not only for babies and children? Mistela also has a range of maternity products like the 100% certified organic Stretch Marks oil, Stretch Marks cream, and the certified organic lanolin-free nipple balm, made up of 100% natural ingredients and dermatologist tested.
You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.